Hello, and welcome to Grey.com Talks With. Today, we're talking with Douglas Jackson, President and CEO of Project C.U.R.E, the world's largest distributor of donated medical equipment and supplies to resource-limited communities across the globe. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app, because today we're going to learn about an organization that is delivering health and hope and touching the lives of patients, families, and children in more than 135 countries. Hello, Douglas. Welcome to Grey.com Talks With. We're excited to have you here.
Thank you. It's great to be with you today.
Wonderful. How would you describe Project C.U.R.E for someone who is not familiar with your work?
So we are now the world's largest provider of donated medical supplies and equipment. And what that means is we go to medical manufacturers, to wholesalers, and to end users like hospitals. And we solicit donations. So they give us everything from catheters to CAT scans, beds and exam tables and ultrasound machines and needles, syringes, suture, gauze, all of that kind of stuff. We take that and put it on 40-foot cargo containers, so the size of a semi-truck trailer, and we ship those, about 200 of them we'll do this year. We ship those into places where people are literally dying because they don't have access to medical supplies or equipment, and then we just give it away.
Wow, that's very noble. Contacting suppliers and hospitals that have access of something, or they can provide an additional to what they already have, and delivering them to places and communities across the globe that really need them is something worth acknowledgement and very noble. How big of an issue is the absence of medical supplies and medical equipment in the world?
It's a very, very big issue in a lot of places around the world. And of course, during COVID over the last year, we saw it hit countries that you never would have thought that it would be a problem. So for the last year, Project C.U.R.E actually supplied U.S. hospitals with things that we refer to as PPE, right? Gloves and masks and gowns, face shields, things like that we needed to fight, COVID and protect our frontline workers. We ran into shortages in Europe. We ran into shortages in Canada and the United States and, places like Japan, places where you never would have thought that we would have had shortages. In a regular year, though, that's the case in a lot of the world. So we work in Africa and Asia, Central Asia, some of the countries of the former Soviet Union, like Ukraine, places like that. We work in Latin America extensively. And these are all places that, because of poverty, of war, of natural disasters, they just don't have what they need to take care of the people.
Wow, pandemic definitely hit many countries, and even the most developed countries not having enough resources because it wasn't planned. You being there to provide a helping hand, that was something really great. But you mentioned that on a regular year, you provide help to communities in Latin America, Central Asia, former Soviet Union countries. And you mentioned several issues that might be the reason why they lack so much medical supplies and equipment, poverty and others. Could you please elaborate on that? Why those governments in those communities are not investing enough in healthcare and equipment and supplies?
Well, in some cases, it's just because, of poverty. I mean, they just are poor. And so, if the statistics tell us, I'll explain it this way, that half the world's population works 12 hours a day and they make about $5.
Mm-hmm.
Right? So if you look at a pair of gloves, is still $2-3. So that's a day's wages. In some countries, they make as little as $1 a day, and they'll work 12 hours to get there, right? So the government simply just doesn't have the money. That's the problem, and so we will step in and sort of fill that gap by providing the things that the hospitals need. And the healthcare is very, very expensive. I mean, in the United States, healthcare is extremely expensive. And if you're an under-resourced country, that's a problem. Then you combine that with something like what we're watching happen in the north part of Ethiopia, where there was a conflict between the people that were living in Tigray and the rest of Ethiopia. Well, then the Eritrean army came into Ethiopia and they stripped out all the hospitals. And so they took the equipment, they took the supplies, and left those people in Tigray with nothing. So we're working on situations like that. In Honduras this summer, they had 2 hurricanes right back to back. They had over 6 feet of water, and all of the equipment and supplies that they had were destroyed. So now you take poverty and you add on top of that conflict or natural disaster. You remember in Beirut last summer when that explosion happened? Well, it ruined some of the hospitals. So Project C.U.R.E got involved, and we shipped medical supplies into Beirut in Lebanon, which typically doesn't need a lot of medical supplies. But they've had a lot of people coming across the border from Syria because of what was happening in Syria. So their healthcare system, even though they're a lot better off financially than someplace like Ethiopia, their healthcare system was inundated with people first from Iraq and then from Syria coming into Beirut. So they have very, very high unemployment, and a lot of those people coming across the border are sick, and they go to the hospital to get taken care of. Well, it just overwhelms the hospital system. Add on top of that, then an explosion, and now you have a disaster, and that's part of the problem.
Mm-hmm. Wow, the story in Ethiopia is very devastating. Poverty combined with conflict, resulting in the loss of many lives and lack of regular medical supplies that many may need, is very sad. But the good thing is that there's organizations such as yours that can provide help when help is needed, when help is most appreciated. You mentioned that you work with organizations, with donors in United States, and you also mentioned that the healthcare is quite expensive. Is there? Do you also collaborate with the organizations, donors outside the United States, where producing those equipments or producing those supplies might be cheaper?
Sometimes, but even companies, let's say, that are headquartered in Korea, Japan, Germany, they make really good equipment. We are working with their distributors here in the United States, and they donate it to us. We've got the thing that makes our organization really unique is our volunteers. Mm-hmm. And in a given year, in a normal year, we'll have around 30,000 volunteers. Mm-hmm. We only have 30 paid employees. Oh, so we have about 1,000 volunteers per employee, right? That's what makes this so unique. And that's why we're able to do what we do, is because of how many volunteers just come and they give their time to process all of the donations. I haven't found that same volunteer culture in other places. We're looking, we tried in a couple of countries in Europe. And the other piece about that is that countries, for example, like in Canada, it's difficult to do this because of the way that the laws are written about what hospitals that are all owned by the government can do with the equipment. They can't give it away. So it's a very unique situation that we have here in the United States where, we buy the best, the latest, the greatest. We buy a lot of it, and we end up with things that we can share with access.
Wow, I couldn't agree more. That's absolutely unique. The fact that you have created an ecosystem that per one employee, there are 1,000 volunteers who are eager to help, who are eager to support the communities across the globe that are in need of medical supplies and medical equipment is wonderful. And the fact now it makes sense why United States healthcare system is quite expensive. You mentioned because everything is new, everything is up to date, everything is of a great technology. So I can understand the point behind it being expensive, that because it is there of the new, it is there of the highest quality to treat patients in the best way possible. You work across the countries, mentioned 135 countries. How were you able to create this this ecosystem of many countries? Because I think like UN or WHO, I only thought those large organizations can do to that extent, but you were able to do that to the similar extent to them. How were you able to achieve that?
Well, the interesting thing is we always wait for an invitation. Mm-hmm. So we've never picked a list of countries where we want to work and then started to work there. We wait for somebody in that country to ask us to come help. And we've never said no. So we've worked in some really interesting places like North Korea. It's not a big deal for people living outside the United States, but Cuba is not a place where United States people are allowed to go. But Project C.U.R.E. went there, and we've helped people in Cuba. We've gone all over the world, literally. And if somebody needs help, we're willing to go and help them. And so that's how we got into all of those places, is people just ask us to come.
Wow. Your organization being apolitic and being there just to support others, no matter of the state of the country, no matter of the political view of the country, no matter of the conditions, just to help the people who lack those equipments and who need support. That's very noble, and I appreciate the work that you guys are doing. On your website, it mentions that you have 4 programs. Kids, there's college, and there's also cargo. Could you please tell us in detail about those programs and what distinguishes one from another?
Sure. Our cargo program is what you see behind me, these big cargo ships, right? These containers. And that's what I told you. We'll do 200 of those this year, which is basically the entire back half of that ship full of medical supplies, right? Wow. And so I took that picture on the Panama Canal, by the way. That's where that is. So there's that. And then we never really set out to, run competition with Doctors Without Borders. That wasn't what we decided to do. But we would go to places and we would visit people in, let's say, Nigeria. And they said, "Oh, thank you for all of this stuff. This is really great. Would you ever have anybody that could come help us? And we could learn together." And we said, "Yeah, maybe so." Then we would get to the United States and we would be sharing with somebody and they would say, "Oh, what you guys are doing is so fun. Could I ever go with you?" We said, "Well, if you're a doctor or a nurse and you want to go, and we have friends over here where we deliver containers and they need some help, let's facilitate that." And so that became our C.U.R.E. Clinics program. And that's where we actually take teams of doctors and nurses, and we go and we work side to side, shoulder to shoulder with the people who we are helping with our containers. And it creates great relationships. Sometimes they'll work together even after they go home, and they'll get on Zoom or Skype or something like that, and they continue those relationships. And we try to go back several times a year so that we're really trying to improve the entire healthcare system with the supplies, the equipment, and some human resources too. Well, that led then to training, and so we started doing training programs with like helping babies breathe, teaching nurses and midwives how to save a baby when they come out of the womb and they're not breathing. So we taught those programs. We taught programs on saving the mother, for example. We do programs on intervention for diarrhea. And so that's the training part. So we call that C.U.R.E. College, right? So we put all of our training programs under one program and we call it C.U.R.E. College. And then the kids program is kind of fun because, like I said, most of what we do is in these big cargo containers. Well, somebody may be going to Nepal, for example, after the earthquake, and they said, hey, do you have medical supplies that we could take with us on an airplane? And so we thought, well, yeah, we can pack that up. And so we put together what we call our C.U.R.E kits. And that's 50 pounds. It's medical supplies. You can come pick those up at the warehouse, or we mail them to people, through UPS or FedEx or whatever. And people will actually check it on as luggage. And they go over while they're doing a medical mission trip. Or, maybe they'll be, let's say that they're from Ghana, West Africa, and they live in the United States, but they're going to go back to their, neighborhood community, and there's a hospital there or a clinic that doesn't have enough medical supplies. They can actually take that over and actually give that as a gift. It's about $2,500 worth of medical supplies in a 50-pound bag. And a lot of people will take it. Or, Rotary people, for example, if they're going to go on a trip, they say, hey, what could we take to the community? And they'll take the C.U.R.E kits. And so that's how we did that. And then there's another little kit that we do that's kind of fun. It's called Kits for Kids. And it's a small bag, and there's about 15 items in that bag that you can buy here in the United States at the CVS store or Walgreens or Target, right? So this is what we call over-the-counter products. So it's Band-Aids, and it's, Neosporin ointment, and it's toothbrushes and toothpaste and all the things that every mom should have to take care of her child. But sometimes there's no Walgreens or CVS or Target available, and so these moms, that little kid will fall down, skin their knee. There's no Band-Aid. It gets infected. The infection goes, and I've actually seen where little kids have lost legs because of a cut that they got on their leg, and it got infected. Well, put ointment on it and a Band-Aid, and the kid will get better. So that's our little Kits for Kids programs. And what we do is we give a little bag to people here in the United States with a list of all the things that they need in the bag. They go to the store, they buy it, they put it in the bag, they write a note on the bag, and then they bring it back and we ship it.
Wow, your programs are quite unique and very rangeful because you're not only just providing one-time help through the cargo program, but you also through the training program and through the C.U.R.E college, you are enabling healthcare workers in those communities work side by side with professionals, with people who have much more expertise from developed world, from US, and also how to do the basic things. So it's also actually elevating and improving the healthcare system, because when the equipment might come, people might not be able to use it or learn or not have a necessary knowledge on how to implement it. But you offering them trainings, you offering them help, sustainable help that is not just one time, but also over 6 months, 12 months when people go and back and forth. That's really unique and really wonderful. And also the fact that individuals can take part in it as well. If someone who is going to Ghana and can have an access luggage or can take an additional 50 pounds, they can make it's a very simple act, but it can make a huge difference for those communities. And you are offering that is very wonderful. So thank you. And I think many communities and many people who deal with your organization are very appreciative of that.
Thank you. Thank you. It's a lot of fun.
Indeed. If someone would like to support Project C.U.R.E, how can they do that?
So the easiest way is just get on the website at projectcure.org. Mm-hmm. And there's a lot of different ways. We have stories they can read, and there's a donate button. If they want to click on that, they can make a donation. It's easy to do too. We've tried to make it as easy as possible. So one of the things we encourage people to do is to join what we call the C.U.R.E Club. And that's a $25 a month. It could be $50 or $100, but $25 is easy. And at the end of the year, that will have delivered over $6,000 worth of medical supplies in a year, right? And what that does is that pays for the delivery of a box of medical supplies to ship someplace. It costs us around $25 to send a box of medical supplies on one of these containers. And so basically you're underwriting the delivery of life-saving medical supplies for as little as $25 a month. Or people can get on and they can look at a project and they say, wow, I've got a project, for example, right now in Chad, Africa, and we're about $2,000 short, right? They've been raising money and we're almost there. Somebody can get on and say, you know what, I want to finish that load. And they can make a one-time gift and finish, the fundraising. But anyway, that's the easiest way, projectcure.org.
Wonderful. The link to the projectcure.org will be provided in the link in the description. And for you listening, if you would like to learn more about the organization and the different projects that Project Cure is working on, you are welcome to check out their website and familiarize yourself with the great work that you're doing. And if you would like to support them, all the links will be provided in the description. Thank you so much, Douglas. It was wonderful to get to know the incredible work that you and your team and the set of volunteers that you have are doing. Thank you.
Well, thank you. And thanks for doing this. It's really incredible, your heart and what you're doing to make organizations like ours available to other people. So keep up the great work.
Thank you. For you listening, if you enjoyed this conversation, please press like and share button because this will show the YouTube algorithm and podcast algorithm that this conversation is important. The lack of medical equipment and supplies is causing a lot of trouble in countries, in third world countries, and even in developed countries. And the organizations such as Project Cure and the donations that can be made to Project Cure can help save thousands of lives. Thank you and see you in the next episode.